everyone officially. I have to introduce myself and say my name is also Gill. I'm in the marketing team at Kieser, and I will be helping Gill out tonight. Just a bit of an intro on Gill. She's been at Kieser now for just over 6 months. Before that, she was working in private practice for about 7 years. She's originally from Canada. She's been in Australia now for around 9 years. That's right. As a clinician, she enjoys supporting her clients in their rehab journey, likes both the manual therapy of Kieser and the exercise, and she has a special interest in treating clients with back pain. She's in for a treat tonight. We'll do a brief Q&A with Gill at the end. So if you guys have any questions throughout the presentation, there's a little Q&A there at the bottom, so just pop all your questions in, and I'll pop in and ask some questions at the end. We'll also send out this as a recording afterwards and pop it into an email. So if you have any other follow-up questions for Gill, I'm sure she'd be more than happy to answer them.
Yeah.
I'll hand it over to you.
Cool. All right. Well, thanks for joining me tonight, everyone. And thanks for the introduction there, Gill. So I'll bring up my wonderful slideshow and we'll get started. Okay. So tonight we're going to be talking about the 5 myths of back pain. So there's a few questions that people generally ask about back pain or think that it's something that they can't do because they have the back pain. So we're going to go through that today. So again, just some housekeeping rules. There'll be time for questions at the end, and so pop them in the chat box and Gill will pop in and out and possibly ask them at the time if they're relevant to what we're talking about. So tonight we're going to talk about, like I said, back pain in Australia, what is pain, 5 myths and the truth behind them, how strength training can help, and what we offer with us here at Kieser. So like Gill mentioned, I'm originally from Canada, for those of you that don't know me, and I've been in Sydney for nearly 9 years. I've worked in a few different private practices, but what really drew me to Kieser was the opportunity to really integrate all of the manual therapy and physiotherapy treatment that I've learned and skills, and make sure that I can kind of apply that with the strength training. So I found it really kind of frustrating in other practices where I just couldn't utilize that proper strength training equipment to really isolate those muscles. And I think that's what's really beautiful working at Kieser and working with the clients and seeing, you know, old clients of mine that have joined me here, and then new clients, and seeing them achieve their goals and also really improve their quality of life. It's actually quite special. So just some statistics around back pain in Australia. So about 80% of Australians will have back pain at some point in their life. 1 out of 6 have chronic low back pain. So that's back pain that continues over that 6 kind of week period where we would say it's more acute. It's the 3rd leading cause of disease burden in Australia, which is accounting for 3.6% of the total burden across all diseases and injuries. It accounts for 1.8% or $1.2 billion of total health expenditure in Australia. And that was in 2011. So that's 10 years ago. Just imagine how much more it would be now. And 73% of people with back pain relapse within the first year. So let's talk about pain. Like, what is pain? So obviously it's unpleasant. It's a sensory, or it can be an emotional experience that may or may not be associated with tissue damage. It's normal, and it's an output. So it's a response to a situation that your brain judges to be threatening or something that's going to be problematic for you. It's an alarm, and it also is a good thing as it protects you, and it is a call to action. So more of a defender, not an offender. However, sometimes this alarm system just gets a little bit out of control and starts firing incorrectly. So hurt does not always equal harm when we have pain. So it relies on the context. So people's thoughts, beliefs, emotions, past experiences, all of those things provide input about whether a situation is deemed threatening. And this all happens subconsciously, and our brain is not exactly equal to the conscious mind. So a perfect example on this is there was this doctor who was walking through a grassy kind of wooded area, and he felt something kind of scratch his leg and he thought it was nothing. And then all of a sudden he was unconscious and on the floor. So he had been bitten by a snake. And obviously he went to the hospital and got fixed and all of that. However, when he went walking again and felt something scratch his leg, his nervous system went into overdrive because it remembered that the last time that happened, he was in a life-threatening situation. So that's a pretty good example of how pain really relies on the context and on past experience. So how did you hurt your back? So Surrey and Al, about 10 years ago, looked at this in more detail. So they asked 154 patients with lumbar disc bulges what they thought elicited their symptoms. So I thought this was quite interesting. So 62% couldn't recall a specific event. 26% reported it was during normal tasks or activities. So they were closing a door, making the bed, doing their housework, they missed a step, twisting. 6% reported it was due to heavy lifting, so over kind of 15 kilos. 2% reported it was due to light lifting, so lifting less than 15 kilos. 2% reported it was non-exertional, so just sitting too much, sneezing. I'm sure a lot of you can relate to the sitting a bit more with lockdown. And 1% reported it was due to trauma, so a slip or a fall. So despite many claims, lifting heavy things is not commonly associated with symptoms of disc herniations. So the risks of strength training are far outweighed by the benefits. So I'm sure you can see where I'm going with this when it comes to back pain. So myth number one is, but I have a disc bulge, and that's what's causing my back pain. So the fact is most people over 50 without back pain actually have a disc bulge. So what you can see here on this slide is disc bulges are very common, and they start to kind of pop up in our 20s actually. And they continue to increase as we age. And as you can see, in people who are around 40 or 50 years old, 50 to 60% of people have them at that stage. And some of those people have pain, some of those people don't have pain. And so even on this one here is kind of saying the same thing. So percentage of abnormal findings on a lumbar spine. So when they're saying abnormal, there might be a disc bulge. They might see that there's some arthritic changes, which would be kind of spondylolisthesis or facet joint degeneration. So that's kind of what you would say is kind of osteoarthritis of the back. And so we can see osteoarthritis in the back is obviously not very common in our 20s, but disc bulges and disc protrusions and disc degeneration is starting to already come to the surface and is in about 25% of us. And then as we get older, that continues to increase. So as you can expect, someone in their 80s is going to have osteoarthritic changes, but they also have disc bulges and other things. So there's a lot of that stuff that's present, and this is present in people who are healthy and also pain-free. So 90% of back pain is what we would call non-specific. So there's no serious pathology, there's no pain kind of going down the leg past the knee, there's no loss of strength in the leg, there's no pins and needles. So that accounts for about 90% of it. 1 to 2% is serious pathology. So that's where we would say, there's cancer or the spinal cord is compromised, and that requires an immediate referral to a specialist. And about 5 to 10% of people have relevant MRI findings. So that's where you find there's a disc bulge, it's impinging on one of the nerves, and that's correlating to the symptoms that are clinically coming from the client. So, we might complain about pain down the leg on the right side. When we do an MRI, we'll see a disc bulge that is pushing on the nerve on the right side. But we also find that some people will have a lot of pain on the right side, but they also have a significant disc bulge on the left, and they'll have no pain on the left. So again, imaging doesn't always correlate to the findings that we find on with the client. So myth number 2 is I need more flexibility. So my back is tight and stretching will fix it. But in fact, strength training has the strongest evidence for treatment of back pain and prevention. So we can see on this graph here, so they did a randomized controlled trial of, I think, 25 different papers. So they had about, I think it was 26,000 people with 3,000 injuries. And this is kind of what they found. And this was more specific to sporting injuries, but obviously we can kind of apply that to back injuries, because that also happens in sport. And so people who were stretching got about 4% decrease in their injury, which is not very much. And you can see that there's significant differences if they don't stretch. And strength training actually did the best job. So consistently favorable estimates were obtained for all injury prevention measures except for stretching, and strength training reduced sport injuries to less than a third, and overuse injuries could almost be halved. So that's pretty good evidence behind that there. So what you can see here is just a cartoon kind of graphic of the kind of muscles around our spine. So we have the front here, and then the back is back here. So around here, we've got kind of our deep oblique muscles, our transverse abdominis. We've got kind of our lats here on the side. You've got kind of your deep hip flexors here. This is your vertebral body. And on top of that, that's where the disc would sit. And then your spinal cord would be in the middle here. And so what we're more particularly interested here is these big guys here that I've pointed to with the light blue arrow. And this group of muscles are called your multifidus muscles. There's different names for each of them, but there's a multifidus, longissimus, iliocostalis, and they kind of make up erector spinae group. And those muscles kind of do like a Christmas tree effect along your spinal cord, and they really help, or sorry, along your spine, and they really help with good stability and control and stability. So what we see here is more of an MRI view of that same cartoon image. So we've got the vertebral body here, we've got your erector spinae and multifidus group in these big black here. So here is what we call grade 0 or no degeneration. So they're nice and black. There's very minimal white in what we would call fatty infiltrates in the area. When we look at this next one here, grade 1 or slight, you can see how these muscles have just gotten a little bit thinner, and there's a bit more fatty infiltrates in there. And that's what's it's telling us that there's a weakness there, and that muscle has kind of gotten smaller as a result of that. And then we can go to grade 2, which is severe, and we can see that they've atrophied quite a bit more. They're very thin and kind of flimsy looking. And that's where we would see that someone would probably have been in a long disuse pattern of pain and injury. So myth number 3, but I'm strong enough. I'm really good at lifting things, so strength isn't the issue. But the fact is lower back strength is decreased by 30 to 40% of people with chronic low back pain. So those little stabilizers are the problem often with back pain, is that they're just not working hard enough, and they're not working well to help stabilize and support our spine. So in 2017 to 2018, only 4 in 10 Australians aged 18 to 64 did the recommended amount of strength training. And when you look at adults over 65, that number is actually cut in half. So if you're not familiar with the exercise guidelines, it's recommended that adults over aged 18 to 64 complete 2.5 to 5 hours of moderate activity, or 1.25 to 2.5 hours of vigorous activity a week. This is done on most, preferably all days of the week. And a part of that is strength training, 2 days a week. So strength training not only helps with back pain, it can also help with a variety of other chronic health conditions. So I've listed them here. So you can do improve muscle strength and tone, which protects your joints from injury. That's what we're talking mostly about today. They maintain flexibility and balance, which can help to remain independent as you age. Stretching can help, but most muscles that are tight are also weak. So that tightness you feel is usually because the muscle is actually not strong there. Weight management is also something that can be helped with strength training. So increase muscle to fat ratio and helps you burn more kilojoules at rest. It may help reduce or prevent cognitive decline in older people, increases your stamina. So as you grow stronger, you won't get as tired as easily. Prevention or control of chronic conditions, kind of like I already mentioned. So diabetes, heart disease, arthritis, back pain, depression, and obesity. Pain management, improve mobility and balance, improve posture, enhance performance of everyday tasks, decreases your risk of injury, increases your bone density and strength, and reduces the risk of osteoporosis, or it also helps reduce the increasing in your osteoporosis if you're already in that category. improves your sense of well-being. Resistance training may boost your self-confidence, improve your body image and your mood. It helps with sleep, and it also helps increase your self-esteem. So if you could put strength training in a tablet, I think everyone would be taking it. So here we have a graph that's kind of going through what happens if we don't do strength training or stay active in our earlier years. So we've got functional capacity on this axis here, and over here it's just increasing age. So in early life, when you're a child, you're growing, playing sport at school, whatever you're doing, you're all going to peak at a certain age. And so when you get to a certain age, you're going to reach kind of like your genetic peak, or as best as you could be, depending on your activity level. So the orange line here is if you continue to remain active in adult life. If you stop being active, that's the blue line there, as you age, you're going to start to decline. And so what we have here is the disability threshold, and you will get to a point where you pass the disability threshold, and that's where you're at risk of falls or going into aged care because you're not able to look after yourself. So we know that if you stay more active for longer, it allows you to have more independence and decreases your risk of disability in your later life. Myth number 4, I can't exercise because I have pain. So I should only exercise pain-free. But the fact is, exercise is the most important treatment for low back pain. Activity avoidance is a great way to avoid back pain today and a great way to guarantee back pain in the future. So if you're constantly not doing things because you have pain, you're basically training that alarm system to go off every time you do something, and you're kind of training it to keep kicking in, and then it gets you into that pattern of deconditioning. So this is the cycle of deconditioning here. So you have an injury or an accident, sometimes it's age or inactivity. So pain then comes on and it inhibits the stabilizing muscles. So those small multifidus muscles that I was talking about earlier. And so they kind of switch off, unfortunately, and that's how they start to atrophy. And because they're not working very well, your big global muscles around there kind of do a protective response, and that's where you might get a spasm. And then that's going to obviously modify how you move, how you do your day-to-day activities. You might not change your sheets as regularly, or when you do it, you're very ginger about it, or picking up something off the floor. All of those things kind of change because of that modified movement pattern. And then that reduces the strength of the muscle. And so the muscle gets smaller and smaller, and then there's a loss of strength, which then increases your susceptibility of recurrence or re-injury. And then you continue down this pathway of deconditioning. So with exercise, what we can do is break that cycle of deconditioning, and that's going to help, induce some endorphins, which help, feel a little bit better. They work similarly to opioids. They help to down-regulate that pain signal to the brain. And with back pain, encouraging those deep spinal stabilizers to switch on can provide pain relief and increase mobility. And it helps to reduce global muscular spasm by encouraging movement. So motion is lotion is really what it comes down to with back pain. If I go harder, I'll fix it quicker. So the myth is if I'm getting a little bit better, I should do more and I'll get better quicker. But the fact is your body's tissues and nervous system need time to adjust. And rehab may take 12 months depending on your history. So progressively overload is key. So you can't go from 0 to 100 when you've only been at 10 for weeks and weeks and weeks or years and years and years. Progressively overloading will help your nervous system adapt and learn to kind of accept this new movement that you haven't done in a long time and avoid kind of triggering that alarm system from going off. So that's where we come in here at Kieser. So as you can see here, we've got one of our machines here. So this is called our F3 machine. And so that's one of the machines we can use to really target those small little stabilizer muscles. So what it does is it helps kind of lock your legs in so that you can't use your big kind of hip muscles, so your glutes and your hamstrings and your quads. And it allows you to really focus on those deep little spinal stabilizers at the back there. So who is Kieser? So as you can see on this graph here, we've got kind of a couple of things going on. So you've got 24-hour gym classes, and then Kieser, and that's kind of where we fit here. So the adult top 5 barriers to participating in exercise. So you've got, too lazy, poor health or injury, increasing age or too old, you don't like sport or physical activity, or not enough time / too many commitments. So, and when you're in your kind of early 20s and you're starting your professional career, you're working your butt off to try and get ahead and that sort of thing. So that's a very common kind of barrier to that age group. So we've got kind of 18 to 44, just too many things, commitments, young families, all that sort of stuff. So that's where those 24-hour gyms come into place, anytime fitness, they're open 24 hours, so you can go whenever. But what we're really interested in is the people who are, aging and still want to look after themselves, but they've got, all these poor health and injuries. And, the barrier to going isn't necessarily no time, but it's more that they are increasing in age and are just not confident in going to the gym. So that's kind of where Kieser comes in there. So Kieser was created by a gentleman named Werner Kieser in Switzerland, and it came to Australia in 2006 with the mission of building a stronger Australia. So like I've mentioned before, Kieser brings together that contemporary physio and then unique spinal strengthening programs that have been used extensively throughout the world. There are 130 Kieser centers worldwide, and all of the stuff that we do here has been validated by scientific evidence and research papers and all of that. So everything here is backed by science, and it helps to effectively break that cycle of deconditioning using clinical reasoning and skills of our physios and targeted, safe, and effective reconditioning of the deep spinal muscles. So strength training is a journey. Like I said, you can't go from 0 to 100. So think of it as a mountain. You're climbing a mountain, and it's not just straight up to the top. There's going to be some valleys that you're going to have to go through and then climb back up. And that's kind of what happens with your little journey with back pain. So how it works here at Kieser is there's, the Kieser health plan. So in the initial phase, you usually, the reason you've come to Kieser is because you have back pain and you can't do the things you like doing because you can't do it because it hurts too much. And so that's usually where you come in and you have an intensive session of physio with exercise introduction, but this is only scratching the surface of symptom management and long-term relief. So I don't know if you remember from the previous slide, we said 73% of reoccurrence happens in a year. And this is why, because people go for that 6 weeks of physio, they feel better, they're happy, and then all of a sudden something happens and it comes back. And so that's what we've tried to stop with Kieser. So this is kind of the initial phase that we propose. And then there's phase 2, or reconditioning. And what I like to call it is where the magic happens. So this is the period where symptoms are usually less, but they can still be a little bit re-aggravated. So you're climbing that mountain, but you still might hit a bit of a valley and have to get back up again. But clients who continue strength training in this phase of treatment have less frequent flare-ups and continue to reap the benefits of strength training, not only for their back, but for their overall long-term health and well-being. And so this phase is significantly longer, and it takes 12 weeks to a year. And, you can expect some plateaus and niggles along the way. But when we get past that year mark, you're less likely to have those flare-ups. And if you do, they're very minimal and they don't last very long. And you're still reaping those benefits of health that can come along with that. So the takeaways from this presentation is imaging does not always correlate to symptoms or damage. Strength training is proven to assist low back pain symptoms in the acute and early phase and minimize recurrence and flare-ups. Strength training is not only helpful for your back, but many other health conditions. Progressive overload is key, and strength training can still occur even if you aren't completely pain-free. So that concludes my presentation. So we'll see if we have any questions. We can get to those here.
Great, Jill. Thank you. I've got a couple questions here that I'll ask you. The first one is from Louise. So she wants to know that when you're talking about strength training in the presentation and the importance of it, do you just need to do strength training on your back to prevent and manage your back pain, or should you be doing strength training all over?
So it's a combination of things. So that's what's really good here at Kieser is we do a whole body program. So we do have specific spinal machines. So we've got the ones to target those multifidus muscles like I spoke about. We've got a pelvic floor machine to help trigger your transverse abdominis. We've got an abdominal curl machine as well to target your rectus abdominis. So those are obviously some very like key muscles usually in back pain, but we also need to target, you know, your adductors, your inner thighs. We need to target your glutes. You know, if you're doing lots of walking, targeting your hamstrings and your quads and maybe your calves, depending on the weakness there. And if you've got specific upper body goals, and we know, especially with women as we age, if you don't sustain your upper body strength, there's a pretty big correlation to, you know, if you fall and you break your wrist and how that can really lead to lots of disability as we age.
Yeah, absolutely. Another question I've got is, some of us we're still in lockdown now for at least a couple other weeks. Are there any exercises we can be doing at home if we can't get into a Kieser clinic just yet to help with our back pain?
Yeah, certainly. Like there are a few that are kind of go-to for me. I will either give, it kind of depends on your, I guess, background and what causes you pain versus what makes you feel better. So there are a few that I'll do kind of just on your back, you know, like a kind of a dead bug exercise, if you will. Or if you're a bit better on all fours, you can go on all fours and do a bit more of like a bird dog type exercise. So that can kind of help just retrain those muscles to work a little bit and help with a bit of, you know, what we would call like proprioception. So understanding, giving you that feedback about where your back is in space, because we know that when people have chronic back pain, you kind of lose sense of where things are meant to be.
Yeah.
Yeah, absolutely.
Another question is, so part of the physical activity guidelines in addition to strength training is just aerobic exercise. So for someone with back pain, are there any specific exercises you would recommend doing or certain ones you might say to avoid?
It really depends. Like I've had clients who will run and they're okay, but I have clients who can't run and are not okay. So it really depends on your activity levels, kind of pre your injury and your background. So almost kind of your like acute versus chronic workload. So what have you done over the last 4 weeks prior to your injury? And then what can you do now? So if you're a power walker, you know, you could probably get back to walking. If you swim, usually a kilometer, you could probably get back to swimming. So it really does depend on what you do regularly instead of just taking up something new because you have back pain.
Yeah, that's great. Another question here that I'll just read out. So she wants to know, do you think that the way that we speak about lower back pain can sometimes influence the way it's treated? She says, for example, you might hear someone say, I slipped my disc or my back is broken. Do you think we might need to work on modifying our language so people are a bit less scared about lower back pain?
Yeah, 100%. Yeah. So I think, you know, education is really key, which is why I'm really passionate about running these type of webinars, because I think it's really important that the language we use actually accurately reflects what actually is happening. I know I can be quite frustrating for clients and for myself alike when they come back from the doctor and the doctor's like, oh, I slipped my disc and I'm really scared about what I can do now, because you feel like you're this fragile being. But discs are often compared to, especially when you have a disc bulge, they're compared to like a jelly donut kind of effect. So they get squished, and that's why that piece of disc is kind of jutting out in that really aggressive, I guess, kind of fashion. But they're actually really, really sturdy, and they're not as fragile as you think.
Yeah. And if you do get a bulging disc, or you think maybe you might have one, how would you go about getting that diagnosed? Who do you see?
I mean, you can certainly see your GP, and they might send you for some imaging. But like I said before, like a lot of imaging doesn't actually correlate to symptoms. So you're probably better off seeing someone in the physiotherapy field, or osteopath or chiro, whoever you're kind of more comfortable with, because they're going to be able to give you some advice on, you know, activity and getting you start moving again, whereas the doctor is just going to be able to send you for medication and a scan. Like that's what's in their scope of practice, unfortunately.
Yeah.
Yeah.
And you talked a lot about the Kieser difference and, you know, the importance of strength training. If you're familiar with Pilates, if I wanted to do Pilates, what's the difference between Kieser and something like Pilates?
So Pilates, I actually think that the Pilates and strength training really complement each other quite nicely. So I was an active Pilates goer. I've gone to lots of reformer classes. I enjoy it. I think it's fun. But the difference, I think, between strength training and Pilates is you can't really get that overload effect that you need to get in order for those muscles to actually grow. So it's good for mobility. It's good for, you know, maybe sometimes that beginning stage of exercise, maybe when you're like a bit acute. But to get that long-term effect, I just think that you need to load those muscles appropriately.
Yeah.
When I have been going, obviously still in lockdown, but when I was going to, I usually go to bar classes and then strength training here at Kieser, I found that I could do the exercises better and activate in the correct areas.
Yeah, absolutely.
Yeah.
A question that I've had a lot of people ask before on back pain is, do you have any opinions on mattresses and a good mattress for somebody with back pain?
Yeah, I actually had someone email me about that earlier today. So I don't have like a specific recommendation when it comes to mattresses. I think, you know, making sure your mattress is comfortable for you. I mean, a soft mattress is probably not appropriate. You do need something that's going to give you that appropriate support, and making sure it's on a good surface. So, you know, a really old slat bed is probably not the best place for your mattress to be. It's probably going to fall apart a lot quicker than if it's on like a proper bed base. You know, making sure you change your mattress every 10 years or 15 years, however often it usually says when you buy them. So usually when you pay for a mattress, if it's more expensive, it, in theory, it should last longer. So that's kind of my opinion on them. Like, I prefer a firm mattress, but I know some people might not. It really kind of depends on you and how you sleep as well. Like if you're a back sleeper versus a side sleeper or a front sleeper, like you really have to make sure that you find what's best for you actually.
Yeah. Another question, little similar to back pain, but a little off the side, is around arthritis. And how can strength training help with arthritis?
So arthritic changes in our back, or even like if we're talking about joints or that sort of thing. So obviously it's been a progressive overload from how we've moved over the years. And that's why there's been some bony buildup in some places that it wouldn't normally be. And those changes, as you can see on the previous slide, I'll see if I can get back to it actually. So those changes come on quite early. So you can see that they start to come on. So arthritic changes could be kind of facet joint degeneration or spondylolisthesis. You can see in even 20-year-olds, that kind of comes on at about 25% of the time, and then it continues to increase into our age. And so basically, if we can strength train around those areas of our arthritic changes, that will make it less likely for the strain to continue in that area. So arthritis is going to go through active and reactive and less active phases, depending on what you've been doing. And so if you can strength train around that, that will help you be less likely to re-aggravate those areas. So even with knee pain or hip pain, shoulder pain, all of that kind of stuff can be managed a little bit better if you're loading appropriately.
Yeah, definitely. I think that's all the questions we had. We'll send this out, send a recording of this afterwards, and we'll pop Jill's email in there. So if you guys have any extra questions, you can just send them along to Jill.
Perfect. All right.
Great. Well, thanks everyone for coming. Have a great night.
You too. Bye.
See ya.